Hi, my name is Alyssa, and I am a dental assistant / certified phlebotomist at Elan Implant Centers for about 3 years. Today, I will be showing you guys how we do our PRF process. So today, I will just be showing you guys here what you will need for the process of the PRF. We are going to start off with a tourniquet. We will need an alcohol pad. You will need, we use a butterfly needle here, a gauze, and a Band-Aid. I have 2 red tubes here and 1 green tube here. The red tube is glass. The green tube is plastic. We use 2 different tubes for the coagulation. This does not coagulate the same way the red tubes will. So this is our PRF presser. This is where we will put the coagulated membranes. We also have the bone holder, which we will place our xenograft and our allograft bone in here. Once this is done being pressed, we wait about 5 minutes for that. We place the membranes into the bone and mix it all together. So one more thing is we will need a syringe. For the green tube PRF, you will use the syringe to take out the white blood cells and place it into the bone where you will mix it all together so it can coagulate better. So in this process, you want it to be as clean and sterile as can be. So you always want to start off placing your gloves on your hands before you start anything. So today I'll be showing you how we draw blood on our special guest, Dr. Molich.
Thank you, Alyssa. I'm so happy that Alyssa is helping us with this presentation. And I know I'm in good hands because that's how she is with all of our patients.
So what I start off with is I use 4 fingers above the elbow. And then I will place my tourniquet in that area and make it tight around the arm. And then I will look for a vein with a good feel to it. So what you really will be feeling for is a bounce to a vein. So this is a great one here. I will take an alcohol swab and I will disinfect the area. So we use a butterfly needle here, and you want the bevel to be up. So you want it pointing this way here. And then you take your thumb and you kind of pull on the skin here. And I always put a finger under the butterfly needle to kind of give me some support there. And then you will place that needle into the vein. And once you see that blood flow through the line there, you will place the tube of blood. So then you fill this all the way up. You just let the blood flow until it gets all the way to the top of the vacuum sealed tubes. So now we're doing that green one we were talking about. So this will be the tube that is plastic. It will not coagulate the same as it will for the red tube. We use this for a different part of the process. All right, so we are all done drawing the blood. I replace this first. I then take the gauze, place it over. I will then place a Band-Aid in that area, and then the patient is all set.
Thank you.
All right, so then we will take our used needle and place it into our biohazard bin right here. So we will now be transferring our blood tubes from the frozen brick into our centrifuge. You always want to keep your tubes of blood in the frozen brick until placed here because you do not want for them to coagulate before they are placed in the centrifuge. And you want them on opposite sides because you want it all leveled. And we will now wait 12 minutes for this to coagulate. We will grab this tube holder and go get our blood. I will then set this. So now I'll be removing the red tubes, caps, and not the green one. We'll do something with that a little bit later in the process. I will remove these and I will now let it sit for about 3 minutes. All right, so I will now pick up the white and red blood cells. I will separate them by using sterile scissors. And I will cut off as much of the red blood cells as I can there. I will then place the white blood cells onto our PRF presser, and I will be doing the same process on this one right back here. I will make sure all of that is there. And then I will place this to press our white blood cells so they can be flat. So I'm now going to grab that syringe, and we will now be using that green sticky bone back here. So now we will be taking off the lid. And as you see, this will not coagulate the same as it did in the glass bottles. So I will now remove the white blood cells. And I try not to get any of the red. We now just set this to the side for a second. All right, so then I will now take my bowl and place our xenograft bone, which is a cow bone. And I will place 1 gram of this into our bowl here. And I will do the same process with our human cadaver bone, which is called allograft. And I will place this right into the bowl. I will then now take the presser off of our membranes here. And I will take this. And now we just cut this into little pieces here. Then I kind of just scrape that. Then I'll take the other one. So we now take the other membrane and we place it onto this plate here as flat as you can. And we use that to place back into the extraction site when we suture that area. We will now take this sticky bone here. We will remove the cap and we will put this into the bone. I usually just mix it around and then place the rest if needed. And the sticky bone will now coagulate in here, which will make it all stick together in the bowl. And then as always, you discard the used needle. Okay, and as you see, that process took about 20 minutes and we are now ready to place your bone for your bone graft.